Assalamualaikum warahmatullahi wabarakatuh. The title paper is titled Radiation Dose Optimization in Radiology, a comprehensive review of safeguarding patients and preserving image fidelity. To kick things off, let's look at the medical paradox that drives this entire paper. On one hand, diagnostic imaging has completely revolutionized modern healthcare by allowing accurate diagnosis and treatment planning. On the other hand, it entails exposing patients to ionizing radiations, which carries inherent dangerous risks. The author highlights that excessive exposure can lead to severe tissue reaction like cataract, skin reddening, and hair loss, as well as a long-term carcinogenic effect caused by DNA damage and cell mutation. Therefore, the core objective of the literature review is exploring how modern radiology can achieve a delicate equilibrium, safeguarding the patient from radiation harm while preserving absolute image fidelity for an accurate diagnosis.
Thank you, Najwa. One of the main points highlighted in this article is that diagnostic imaging is essential for accurate diagnosis and treatment planning. However, imaging procedures may expose patients to ionizing radiation, which can pose potential risks if not properly managed. Therefore, the article focuses on radiation dose optimization, which aims to reduce radiation exposure while maintaining diagnostic imaging quality. The authors also emphasize the ALARA principle, as low as reasonably achievable, as an important guideline for radiation protection in radiology practice. Alright, regarding the methodology, this article used a comprehensive narrative review approach, and the authors review previous research studies, technological developments, and international guidelines, including those from the ICRP, which is International Commission on Radiological Protection. And the review discussed radiation dose principles, factors affecting patient exposure, optimization strategies, patient-specific consideration, and also quality assurance measures. By combining information from various sources, the authors provide an overview of current practice in radiation safety and dose management. So Najwa, based on your introduction, do you agree that dose optimization is important in ensuring patient safety while maintaining good quality image?
Yes, I agree with you, Sophia. Thank you, Sophia, for explaining the key points and methodology. I will present the findings of the article. The article synthesizes several breakthroughs findings across radiation protection, variables, and technology. Radiation safety relies strictly on keeping the exposure as low as reasonably achievable. This is executed using a foundation triad of minimizing exposure time, maximizing physical distance, and employing proper lead shielding. Radiation doses are never one size fits at all. Patients with a morbid obesity require higher dose to capture clearer image, whereas pediatric patients and pregnant individuals have heightened biological sensitivity and mandate strict tailored lower dose protocols. Other than that, modern software acts as a shield. Iterative reconstruction provides a massive noise reduction, so clinicians can lower the radiation dose without losing anatomical detail. Additionally, advanced automatic exposure control AEC uses a real-time 3D modulation to adjust to a patient's exact anatomy. With a professor-triggered cating in cardiac scan fires the axillary rim only during the critical phases of the heartbeat, reducing exposure time by up to 70%. Safe radiology demands routine machine calibration of parameters like CT numbers, slice thickness, and uniformity. Clinicians realize diagnostic reference level (DRLs), which act as standard upper threshold to ensure routine institutional exams do not exceed the safe limits. Do you agree with me?
Yes, I agree with you, Najwa. There are many strengths in this article, which I will briefly explain. The article has several strengths. First, it provides a comprehensive review of radiation dose optimization by covering important topics such as radiation safety, the ALARA principle, quality assurance, and technological advancements. Second, it uses credible and up-to-date references from organizations like the IAEA, ICRP, and WHO, which increase its reliability. Finally, the article discusses practical dose reduction techniques while maintaining image quality, making it useful for clinical practice. Next is the relevance. This article is highly relevant to radiology because radiation dose optimization is essential for ensuring patient safety while maintaining diagnostic image quality. It is particularly useful for radiographers, radiologists, and healthcare students as it provides practical strategies that can be applied in clinical settings. The discussion of emerging technologies such as artificial intelligence and advanced reconstruction techniques also highlights the future direction of radiology practice. After the strong which I already explained in the previous part, I will also include the relevance of this article. Next is the relevance. This article is highly relevant to radiology because radiation dose optimization is essential for ensuring patient safety while maintaining diagnostic image quality. It is particularly useful for radiographers, radiologists, and healthcare students as it provides practical strategies that can be applied in clinical settings. The discussion of emerging technologies such as artificial intelligence and advanced reconstruction techniques also highlights the future direction of radiology practice. Therefore, I will pass the discussion to Patricia to explain the weaknesses and conclusion.
Thank you, Fariha. Although the article provides valuable insight, there are several limitations. Now, I will discuss some weaknesses of this review article. Firstly, the article lacks a detailed review methodology. Although it is presented as a comprehensive review, the authors do not clearly explain how the literature was collected. There is no information regarding the search strategy, databases used, inclusion or exclusion criteria, or the process of selecting relevant studies. As a result, readers may find it difficult to assess the reliability, transparency, and completeness of the evidence presented in the review. Secondly, the article focused mainly on summarizing existing information rather than critically analyzing the studies that were reviewed. Most sections describe important concepts such as ALARA principle, quality assurance programs, and radiation dose optimization technologies. However, there is limited discussion of conflicting findings, study limitations, or challenges faced when implementing these strategies in clinical practice. This will reduce the depth of the review and limits its contribution to critical academic discussion. Another weakness is the lack of quantitative evidence supporting the effectiveness of dose reduction techniques. Technologies such as automatic exposure control, or known as AEC, iterative reconstruction, and prospective ECG gating are highlighted as effective approaches for reducing radiation exposure. However, the article provides very little numerical data, statistical results, or comparative analysis to demonstrate their actual effectiveness across different imaging modalities. Finally, the discussion of future technologies is relatively brief. Imaging developments such as artificial intelligence, radiomics, and augmented reality are identified as promising innovations in radiology. However, the review does not thoroughly examine their clinical applications, current limitations, implementation challenges, or supporting research evidence. Consequently, the article lacks sufficient depth in addressing emerging technologies that may play a significant role in future radiation dose optimization. So, in conclusion, while the article provides a useful overview of radiation dose optimization in radiology, its lack of a clear review methodology, limited critical analysis, insufficient quantitative evidence, and brief discussion of future technologies reduce its overall strength as a comprehensive review paper. So, Nadia, do you think these limitations will affect the ALARA principle?
Yes, I agree with you, Batisha. This limitation may affect how ALARA is applied in practice because there is limited evidence on real clinical outcome. However, ALARA still remains a key principle for ensuring radiation safety in radiology department. In this session, I will explain about the ALARA principle, which stands for as low as reasonable achievable. ALARA is a fundamental principle in the radiation protection that aims to minimize radiation exposure while maintaining image quality for accurate diagnosis. This principle is based on three key concepts. First is distance, second is time, and shielding. Radiation exposure can be reduced by minimizing exposure time, maximizing distance from the radiation source, and using protective shielding such as slit apron and barrier. By applying this measure, healthcare professionals can protect both patient and staff from unnecessary radiation while ensuring effective diagnostic imaging. Next, I will share to you guys about the equipment and technology advancement in radiation dose optimization. Modern imaging systems are equipped with advanced technologies that help reduce radiation exposure without compromising image quality. For example, include flat panel digital detector, automatic exposure control or AEC, and iterative reconstruction technique in CT imaging. These technologies improve image quality by reducing noise and enhancing atomic details while using lower radiation dose. They are particularly beneficial for vulnerable patient groups such as children, women of childbearing age. As a result, technology advancement plays an important role in improving patient safety and diagnostic accuracy. Another important application is image acquisition parameter optimization. This involves adjusting images parameters such as KVP, MAS, signal-to-noise ratio, and reconstruction algorithm. The goal is to achieve the best balance between radiation dose and image quality. By selecting appropriate image parameters based on the patient's condition and the examination being performed, radiographers can obtain high-quality image while minimizing unnecessary radiation exposure. This helps improve patient safety without affecting diagnostic accuracy. Finally, I will explain about the quality assurance or QA and control measure. QA programs are essential in ensuring the reliability, safety and effectiveness of diagnostics imaging procedure. This program includes routine equipment inspection, quality control testing, patient dose monitoring and regular calibration and maintenance of the imaging equipment. By implementing of QA measure, radiology department can maintain consistent image quality, reduce technical error, ensure compliance with radiation safety standard and improve overall patient care. Therefore, QA plays a vital role in supporting radiation dose optimization and maintaining high standard in radiology practice. Before we end, does anyone have final doubt?
I agree with you, Nadia. Despite this article highlights the importance of radiation dose optimization in radiology to ensure patient safety while maintaining high quality diagnostic image. It emphasizes key strategies such as the ALARA principle, technological advancements, quality assurance programs, and compliance with radiation safety standards. So overall, the review shows that continuous improvements in imaging technologies and radiation management practice can help reduce unnecessary radiation exposure without compromising diagnostic accuracy. As technology continues to evolve, further advancements in dose optimization will play an important role in enhancing patient care and improving radiology practice. Thank you.
Reflecting on this assignment, analyzing this literature has deeply strengthened my personal accountability and a communication skill as a future health science professional. I have come to realize that radiation safety is not just a technical machine settings. It is a collaborative duty requiring ongoing communication between radiologists, medical physicists, and technologists. Furthermore, I learned that technology advancements must run parallel with empathic patient education. By clearly communicating the benefit of a necessary scan, we can elevate patient anxiety, increase clinical compliance, and directly improve overall healthcare outcomes. Thank you.
Now, moving on to my personal reflection for this article review. After reviewing this selected article, I gained a deeper understanding of the importance of radiation dose optimization in radiology. The article helped me realize that maintaining image quality while minimizing radiation exposure is essential for ensuring patient safety. As a medical imaging student, this topic is highly relevant to my future profession because radiographers play a key role in applying radiation protection principles during imaging procedures. This review has increased my awareness of the responsibility of healthcare professionals to follow the ALARA principle and utilize appropriate imaging techniques. Overall, the article is strengthened and reinforced the importance of continuously improving my knowledge and skills to provide effective radiological service.
This assignment improved my understanding of robotic technology in interventional radiology. I learned how robotic system can enhance accuracy, reduce radiation exposure, and improve patient outcomes. It also increased my awareness of the benefits and challenge of the robotic-assisted procedure in modern radiological practice.
This article helped me understand the importance of radiation dose optimization in radiology. It highlighted the use of the ALARA principle and advanced technologies to reduce radiation exposure while maintaining image quality. So overall, it increased my awareness of radiation protection and patient safety.
After reviewing this article, I gained a deeper understanding of how important radiation protection in diagnostic imaging. The discussion on ALARA principle made me realize that it is important to optimize radiation exposure while maintaining imaging quality. Also, I learned how factors such as patient characteristic, imaging equipment, and also exposure settings that can affect radiation dose. Overall, this review has strengthened my awareness of patient safety as future radiographer for continuous improvement in radiology practice.